Dr. Samuel Baharestani here, oculoplastic surgeon in Smithtown, New York, here in Long Island. We're going to be doing Restylane Refyne injections to the lips in a patient who's previously had lip filler injections. The filler injections she's had before done in the past have kind of worn away, or the body has broken them down, so she's ready for a little bit more filler injections. I'm going to point out a few things. Kathy, you can lean back here. So Kathy has some vertical lines in her lips. She's lost some volume in her lips as well. Our goal today is going to be to outline the vermilion border. That's the border of the lips where the lips end and the skin begins, to kind of give that lip liner effect. That'll hopefully help to improve some of those vertical lines that have come out from volume loss. I'm going to start by cleaning around the skin there, and then we're going to start with the filler injections. Now we're going to be using Restylane Refyne. It's kind of a newer technology filler that lasts a little bit longer than some of the traditional fillers. We're probably not even going to end up using a full syringe because Kathy doesn't really want us to change her look too much. She basically just wants us to replace some of the volume that she's lost. So you can relax your lips there. We're going to start by going around the vermilion border. First little pinch coming. So she's been pre-treated with a little bit of numbing injections in the area to kind of numb around the mouth. But the filler injections themselves actually have numbing in it as well, just like many of the other fillers these days. You may start to feel it here in the middle a little bit. Great, you're doing awesome. All right, we're going to go around to the opposite side here. So the nice thing about the lips is that you can see the results right away. If you compare one side to the other, you can kind of see already the areas that we've treated. And you see I'm just going around the vermilion border, or giving it that lip liner effect here. It doesn't take much to kind of achieve that. For patients who have too much, that's when they start to look unnatural. And when it comes to lip filler injections, we like to maintain the normal ratio between the lips. We always want the lower lip to be slightly bigger than the upper lip. That's what maintains the natural result. It's those people that have too much lip filler injections, especially in their upper lip, that don't really look natural afterwards. And that's when you start to notice and start to get afraid. You think of those crazy people on TV that don't really look like themselves anymore because they've had too much lip fillers or too much filler in a specific area, like too much filler on their upper lips, not really balancing it with their lower lip. And I'm going to come all the way out here. Great. So if you look, she's kind of had a nice volume effect. Emer, you can just wipe there for us. It's given her some volume, made the vermilion border stand out a little bit. I'm going to give her a little bit of filler on the lower lip just to maintain that ratio, maintain the lower lip being a little bit larger than the upper lip. For this, we give it in the lip itself, not necessarily on the border, to replenish the volume that she's lost with age. Great, and then a little bit more out here. Perfect. Okay, and wipe there for us. So people typically won't get too much bruising there. I think we're going to stop there because that's already given us a nice fill with the lips, and Kathy has requested a more subtle look to there. So that was about 3/4 of a syringe for the Restylane Refyne. And you can see the nice result that we've had there. These results will last for up to a year. At that point, our patients will decide to either come back more or actually even come back before it all goes away to kind of maintain the results that they've had or what we've tried to accomplish today. For patients who are interested in cosmetic consultations, we offer free cosmetic consultations in our offices throughout Long Island. I encourage you to call our offices today to schedule that consultation. Thank you.